Is this tiny pill a lifesaver, or is it the biggest medical scam of the century? Every day in my OPD, patients come to me with a prescription and fear in their eyes. They ask me, Dr. Saab, मैंने YouTube पे देखा है कि cholesterol medicines या statins actually damage the liver. They cause memory loss. They destroy muscles. Do I really need this? And there is a war of information going on. On one side, guidelines say lower your cholesterol. On the other side, so many influencers scream, cholesterol is innocent, statins are poison. Such kya hai? As a vascular surgeon, I don't just read books and articles. I operate upon that arteries that get blocked when cholesterol goes wrong. I see the gangrene, I see the strokes and the heart attacks. Today, we are going to end this controversy once and for all. No big pharma talk, no fear-mongering, just pure scientific truth about statins. So should you take them or should you throw them in the dustbin? Let's find out. Namaste friends, I am Dr. Sumit Kapadia and welcome back to the channel dedicated to your vascular health. And today's topic is controversial. Statins, atorvastatin, rosuvastatin, names you probably see on your parents' prescription or maybe your own. In India, we have a unique problem. We are genetically prone to heart disease, but we are also very skeptical about long-term medication. The biggest fear is, एक बार शुरू किया तो जिंदगी भर लेना पड़ेगा. In the next 10 minutes, I will explain exactly how these drugs work, not just in lowering numbers, but in stabilizing your arteries. We will discuss the real side effect and which ones are fake. And finally, I will give you a checklist to decide if you actually need them. If you care about your heart or your parents' health, watch this till the very end. So let's start with the biggest misconception. Most people think statins are just number-lowering agents. You get a blood test, cholesterol is 240, you panic, you take a pill, it goes down to 180, you are happy. But here's the secret. Treating the number is useless if we don't treat the artery. Imagine your arteries are like plumbing in your house. Cholesterol is not just fat floating around. It is building blocks for your cells. But when there's too much of bad cholesterol or LDL and your arteries are inflamed, that cholesterol sticks to the walls. Now pay attention here. This is crucial. It's not the amount of plaque that kills you immediately. It's the stability of the plaque. If you have soft plaque in your arteries, this is dangerous. And if this soft plaque bursts or ruptures, your body rushes to clot it. And boom, 100% blockage in seconds. And that is a massive heart attack or a stroke or leg attack. So why am I telling you this? Because statins are not just cholesterol-lowering drugs. They are actually plaque stabilizers. They act like cement. They take that dangerous soft bursting plaque inside your artery and turn it into a hard, stable scar. A stable plaque does not burst often. A stable plaque also does not cause sudden heart attacks. So when a doctor prescribes a statin, they are not just fixing your lab report. As doctors, we are trying to prevent that explosion inside your arteries. Now let's address the elephant in the room, the controversy. You'll see videos saying statins are a multi-billion-dollar scam. And yes, in the US, pharmaceutical companies do make a lot of money. But let's look at our Indian reality. In India, we have so many medicines available from different companies, ranging from branded companies to generics. Most of these have statins available at a very low cost. Actually speaking, a month's supply of statin would cost less than a large pizza these days. So many companies manufacturing the same medicines, the costs are within range of almost everyone. However, the skepticism and controversy isn't entirely wrong. In the 90s and early 2000s, doctors prescribed statins to everyone. Even if you had low risk, they gave you a pill. That was wrong. But science has evolved. We now know that statins are no longer vitamin C. They are powerful drugs. And just like any powerful drug, they are not for everyone. The controversy exists because we started over-prescribing them to people who could have managed with just diet and exercise. But for the high-risk patient, the diabetic, the smoker, or the person with a history of stroke, calling statins a scam is dangerous. For them, it is a life jacket. So the question actually changes from are statins bad to do I specifically need them? Now let's talk about the fear part, the side effects. And muscle pain or myalgia is the number one complaint. डॉक्टर जब से गोली शुरू की है शरीर टूट रहा है. True or false? Well, partially true. 5 to 10% of patients do experience muscle aches, but studies also show a strong nocebo effect. Now we all know about placebo effect. This nocebo effect is something interesting. It means that if you expect a pain, you will feel pain. So for some, it may be real, but if there is severe pain, then we can stop the medicine, check your CPK levels, or maybe switch to a different molecule like rosuvastatin instead of atorvastatin, or lower the dose. The second myth is about liver damage. Liver kharab ho jayega. Actually, statins are very safe in the liver. In fact, people with fatty liver, which is nowadays again another epidemic India is facing, actually benefits from statins because it reduces the fat in the liver. Dangerous liver failure from statins is extremely rare, and monitoring of SGOT, SGPT can be done, and so this medicine is not too dangerous for your liver. The third is the risk of diabetes. This is partly true because statins can slightly increase your blood sugar level, but here's the trade-off. The risk of developing diabetes is very small as compared to the massive benefit of preventing a heart attack. If you are pre-diabetic, we don't just stop the statin. We tell you to be more stricter with your diet, and that is the benefit you can give. It's actually a risk-benefit calculation. So would you prefer slightly higher sugar numbers or a blocked artery? Coming to the fourth side effect of memory loss and brain fog. Current data does not support this truly. In fact, by keeping your blood vessels clean, statins may actually help prevent vascular dementia in the long run. And studies are still undergoing for proving this. Now comes the most important part of this video. Doctor, do I need to take this pill? So remember, this is the checklist, and I divide our patients into 3 different categories. The category 1 is the must-haves. They must take it for secondary prevention. And when I say secondary prevention, it means if you have already had a heart attack, a stroke, an angioplasty, bypass surgery, or if you have peripheral arterial disease, which is blockage in the leg arteries, that is my specialty, then you need statins, non-negotiable. Here we are not only looking at your cholesterol number. Even if your cholesterol is normal, you need the plaque stabilizing cement effect. Do not stop these medicines based on a simple WhatsApp forward. Category 2 is about the high risk. Suppose you are a diabetic for more than 10 years or above the age of 40 with diabetes, high blood pressure, positive family history, then highly recommended. So statins can help to keep your blood vessels strong and healthy. So in these, it's a risk-benefit ratio that we evaluate. And category 3 is the gray zone, which is for primary prevention. And this is where the controversy is. So you're above 40 years of age, you have no diabetes, no heart attack, no positive family history, but your cholesterol is 240. Do you need a pill? Not necessarily. If still you want to rule out any risk factor, you can undergo a coronary calcium score, which is a simple CT scan, and it will give you a scoring. And if the score is more than 400, it means you have silent disease. So you need statins immediately. So if you are in category 3, stop guessing, get data, and then go on to the next part of this video. So finally, a big question many of you ask us is, can you beat cholesterol naturally? क्या तुम बिना दवाई के भी ठीक कर सकते हो? Yes, giving up processed sugar, reducing your fried foods, and increasing your fiber helps. But remember the Indian context. We love our ghee and oil. But if you are in the gray zone, I give my patients a 3-month challenge. Change your diet, walk 45 minutes a day, lose 5 kgs, and if the numbers drop, great, no medicine. But if you have a genetic cholesterol problem where your body can produce cholesterol even if you eat grass, then diet alone won't work. You will need the medicine. Friends, statins are not magic beans, nor are they poison. They are a tool that has saved millions of lives, but also a tool that is sometimes overused. Don't be afraid of the medicine, be afraid of the disease, but also be empowered to ask your doctor, what's my actual risk? Can I try lifestyle changes first? Do I need to go in for a calcium score? If you found this balanced view helpful, please share this video in your family WhatsApp groups. It might save someone from stopping a life-saving medicine out of fear. And don't forget to subscribe for more honest, scientific vascular health advice. Stay healthy, keep your arteries clean.